Good afternoon, folks. This afternoon's topic B is diabetes and its effects on memory. So we'll dive into that for this afternoon. Give me a few minutes to set up for the show, and I'll be right with you, please. Okay, folks, let's go. What the headline means. The breadcrumb trail. This is diabetes and memory risks, symptoms, and treatment. Okay, so we're going to discuss the whole thing this afternoon for B. So please join me in today's discussion. B situates the piece within the site's broader library of educational content. It signals that this blog style article intended for everyday readers rather than a technical research paper. The title clearly identifies the focus: how diabetes intersects with memory, health, while the line February 26, 2023 by Diabetes Care provides publication date and authorship, grounding the article in time and source credibility. Core message of the article. The central theme is that diabetes doesn't just affect blood sugar, it can also compromise brain function and memory. The article emphasizes two pathways. Short-term memory loss often occurs during episodes of hypoglycemia, dangerously low blood sugar. These lapses are usually temporary and resolve once glucose levels are corrected. Long-term memory decline is associated with chronic hyperglycemia, consistently high blood sugar. Over time, this damages blood vessels and nerves in the brain, raising the risk of dementia. Research cited in the article underscores that people with type 2 diabetes face twice the risk of developing dementia compared to the general population. With Alzheimer's disease highlighted as a major concern. Common symptoms described: the article provides a practical checklist of warning signs that caregivers and individuals should watch for. Repeatedly asking the same question, or forgetting recent activities, confusing or misusing everyday words, e.g., saying desk instead of chair, taking longer to complete familiar tasks, such as cooking from a recipe. Misplacing objects in unusual places, like leaving a phone in the refrigerator, sudden mood swings, or unexplained behavioral changes, difficulty recalling where items are kept at home in the home. These examples illustrate how memory issues can disrupt daily routines and relationships, making early recognition important. Other conditions and contributors. The article broadens the lens beyond diabetes itself, noting that memory loss can be compounded by Alzheimer's disease, with older women who have diabetes at particular high risk, small strokes, transient ischemic attacks that damage brain tissue, high blood pressure, which strains the blood vessels in the brain, medications such as anti-anxiety drugs, cholesterol-lowering agents, or antidepressants, and sleep aids. Hypothyroidism, an underactive thyroid that shows metabolism and that slows metabolism and cognition. Emotional disorders like stress, anxiety, or depression. Alcohol misuse, which impairs brain function. The holistic view reminds readers that memory decline is often multifactorial, requiring careful medical evaluation, management, and treatment advice. The article stresses that blood sugar management is the cornerstone of prevention and treatment. Practical steps include eating a balanced diet rich in whole foods, exercising regularly to improve insulin sensitivity and circulation, taking prescribed diabetes medications consistently, monitoring blood glucose as recommended by healthcare providers. It also encourages addressing reversible contributors, treating high blood pressure with medication. Adjusting or switching drugs that may impair memory, taking thyroid medication if hypothyroidism is present. Reducing alcohol consumption. For those already experiencing cognitive decline, the article notes that certain medications available in Canada will help slow Alzheimer's progression, though these should be discussed with healthcare team. Where to go next on the page. The site positions the article within a larger ecosystem of resources. Readers are directed to related posts on thyroid disease and brain health in diabetes, reinforcing the interconnectedness of endocrine and cognitive health. There are also links to practical lifestyle content, recipes, exercise tips, and healthcare team guidance, plus a newsletter subscription for ongoing support. Broader takeaways. The surrounding content frames diabetes not only as a metabolic condition, but one with profound neurological implications by weaving together risk factors, symptoms, and management strategies. The article encourages proactive care, maintaining blood sugar control, recognizing early warning signs, and addressing coexisting health issues can help preserve memory and quality of life for people living with diabetes. Okay, guys, so that is your B. I will be back on with C shortly. Give me a bit to put that together, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.